Hello, this is Manar Kassem from the Nutrition Intervention Program, or NIP Clinic. This program is designed for children with special needs. During my practice, I noticed that most, if not all, children with developmental issues, whether it's physical or mental, they do test positive for heavy metal toxicity, and we're mainly talking about lead and mercury. It's also one of the primary concerns of the parents. So first of all, I decided to talk to you today about heavy metals, and let's talk about the sources of heavy metal toxicity. Lead, we are mainly concerned about two things, lead and mercury. Lead is an environmental hazard. Children can get it from water, they can get it from paints, they can get it from the air. But mercury, on the other hand, the primary source of mercury toxicity is vaccination. And you might have noticed that over the past decade, the number of vaccinations that children are receiving had significantly increased. The other significant source of mercury would be big-sized fish, like tuna, if the mother eats a lot of tuna while she's pregnant, or if the child is served a lot of tuna every day. I'm talking about every day, but it's safe to take small amounts, of course. So, saying this, you might think that all children need to be screened for heavy metals. Why not, first of all, but you need to be alarmed if your child has any concern, whether it's physical or mental. If the child is hyperactive, if the child has received a diagnosis of autism or related disorders, if the child has like learning disability, or he's not focusing in class, and this is very easy to notice. Then you need to screen them for heavy metal toxicity. Now, how does the screening go? The gold standard would be the hair test. You just send like a small sample of hair. There's another test available as well. It takes a urine sample, but it's an indirect test testing for a biomarker that which is called urinary porphyrin, which indicates the presence of heavy metal in the body or not. But please do not rely on the blood test, because blood test is like throwing a bucket in the sea, in the open sea, and then if the bucket doesn't have any fish, then we can assume that the sea doesn't have fish, and that's not the case. So it's not reliable. Here at the NIP clinic, we have a biofeedback device, and this biofeedback device can give an initial screening. It can indicate if the child needs further lab work to confirm the result, or the child is clean. Usually children have a good functioning, effective system to clean the heavy metals from the body, but only for a few children this becomes very problematic, and it stays there until you intervene and you do something to clean it out. So once heavy metals are detected, there are two main methods to clean them out. The first one is called chelation, and we do not do chelation here at the clinic because there is a potential risk that it depletes the minerals, the essential minerals from the body, and there are health consequences to that. However, this can be done very safely in other clinics with a lot of supervision, of course. But here at the NIP clinic, we do something called clatheration. Clatheration depends on some herbal remedies, things that you use in the kitchen like cilantro, but in different concentrations and over a certain period of time with some monitoring to over a course of 6 months to a year until the heavy metals are cleared. And you should expect your child to gradually improve during that course of 6 months to a year. Now, I hope you enjoyed watching this video. In order to receive more information and more videos about children and nutrition, please subscribe to my YouTube channel. You can also email me if you have any question at info@nutritionip.com. Please visit our website, which is www.nutritionip.com, and you can also write your question down below and I will respond to it. Thank you very much, and enjoy the rest of your day. Bye.